last storm we had.
Yeah.
It doesn't help.
The flash flood warning.
Yeah, that was like a week and a half ago.
No, it just came on. It just
You're going
to my phone yesterday.
Did we expect
And
to-
it said it was in effect until Wednesday.
Mike is on.
Which would have been.
Oh, okay.
fine. Yeah.
Oh, is that-
So maybe it was delayed. I didn't really look at the date.
Yeah, there are maybe more participants that don't have to.
Oh, okay,
Mhm.
maybe that was
Gonna
it.
do it
Maybe
then.
it just got delayed for some reason.
So, congrats.
Then Mike, can you hear us?
I can, yes.
Oh,
Okay, we're not hearing you, just a moment here.
Yeah.
No volume.
I'm all the way up.
and the system's glowing blue, which typically means it's working.
We are using that.
Yep. That's really.
Oh, Mike's muted. Hey,
Try,
Mike,
yeah, try again.
Can you hear me?
there you are. You coming through loud and clear. Thanks. I think we were muted on the machine. Right.
All right, thank you. We'll come to order. Welcome, everybody. Thanks for being here today. We have a lot of business to get through, starting with reviewing and revising the agenda. Any additions or any additional information about the agenda that we need to address before we get started? All right. Next, reviewing the minutes from our May 28th, 2026 meeting. Does anybody have any corrections or additions to the minutes? Looks good. The minutes will be adopted. Next, moving on to introductions and recognition. Brenda.
Thank you, Mr. Chair, members of the board. Good afternoon. We do have and some introductions and also some recognition to celebrate with you today. The new staff introduction is Theo. He's sitting back here, and I'll kind of get out of your way so you can see him. Theo has joined us joined the Water Quality Protection District, and we're really excited to have him. And I'll just let him introduce himself and a little bit of his background and how much, of course, he loves being with public health now. So,
I'm Theodore Lewis. I come from you guys from the Department of Environmental Quality. I was a reclamation specialist for the mining bureau there. So I did a lot of water stuff and a lot of vegetation, the whole realm of the mining. Born and raised in Montana. Went to school at University of Montana. So go Grizz. You don't like I know that's a hot topic. But I really enjoy all things water. I'm here to help. So if you have any questions, please don't hesitate to give me a call.
Great resource. Yeah.
do you want to talk just a hair about what your role is with water quality?
Yeah. So in the Water Quality District, I'm pretty much my basic roles are checking all the well levels, whether it's quality and quantity, also doing discharge for Prickly Pear, 10 mile, all the streams, creeks around us to make sure we're looking at flood gauges and quality and also quantity of water we have there. Also, I've been tasked with doing a little bit of education and outreach from the program. So we've adopted 3 things that kind of get in the community, show a community about different ways to protect our water and to conserve on water, anything water related. So it's pretty fun. Yeah, just gonna have some fun projects coming up, and well, that's kind of what we got.
If you're not already following Lewis and Clark Public Health Facebook page, I highly recommend it. But because we're also sharing what's happening on the Water Quality Protection District Facebook page, but Thomas the turtle is awfully cute. And that's thanks to Theo and all of his creative work that's happening. So really great way to get some education out to the public in a fun and entertaining way. So.
Yeah, I kind of wanted to create something kind of like Smokey the Bear, how people, could prevent forest fires. Thomas the Turtle is someone that could help prevent water quality disasters or to conserve on water or how to protect our water bodies in Helena, Montana and surrounding areas. So it's something to kind of just send out to the public, make it fun for families to talk about with children, because I think that's what really starts when children are hyped up about something, mom and dad are hyped up about it. So start at the base and work up. So
Theo's been with us for it feels like a few days. I can't remember exactly when you started, but it feels like you started 2 days ago. And he's been able to accomplish a great deal of work. I think it was on day 2 that I saw you gear up and head out the door to
Yeah.
go do sampling and, water levels. And so he hit the ground running and hasn't stopped since. So we're really good, really grateful to have him.
Mhm.
Thank you. I appreciate being here. Like I said, door's always open. Give me a call, stop in the office. I'm here to help. Anything. So whatever you need.
Great.
Like-
Welcome.
Yeah.
Thank you. You're welcome to stay if we have busy doing other things.
Yeah, I was gonna head to the
Yeah,
field.
yeah.
Thanks, guys.
Get his waders on.
Yes, ma'am.
Next employee of the quarter.
All right, so as the board remembers, we recognize employees within the health department every quarter that kind of go above and beyond and really exemplify our core values that we have in the health department and work to achieve the mission that we've set forth. So this is a peer nominated, peer selected process that we have within the health department. We had, again, as we've had now for a while, it's becoming harder and harder to select the who gets recognized, because every time every time we have multiple nominations that come in, and they're all high quality nominations, and really everyone deserves to be recognized. But this quarter we chose to recognize Shelley and her team. The public health nurse team has been working diligently, and so it's been such hard work to get their kind of arms wrapped around our current outbreak, which Shelley is here to actually give you a briefing on what's happening with the chlamydia outbreak. But her team is just phenomenal. They are smart and professional, and they are going above and beyond to work with teenagers who can sometimes be difficult to work with. And they're just doing great work. They're doing great work bringing them into the health department. They're doing great work having these really hard conversations, connecting them to resources in this community. And so it's probably a recognition that's long past due, really, because her team is just consistent and hardworking and phenomenal. But we're taking this opportunity now to say thank you for everything that you do and recognize your team.
On line 2.
Oh,
Thanks, Steve. We love you. I would say that I do a lot of the administrative work, so it's all them that's on there that does the interviewing and all that, and they are fantastic. They are. Well, I couldn't do my job if they didn't do theirs, right?
Yes.
So they are great nurses. I'm really lucky.
yeah.
We're really lucky.
Yes.
Yeah.
So thank
So,
you.
yeah.
And thanks to Ray and Heidi and Angelique. Joni is part of the team as well. And so if they're all on, kudos to you all as well. All right.
Excellent.
And then we have one more, and we don't do this one often enough. And so this actually is something that I would like to see kind of implemented on a more regular basis, but a community partner appreciation. And unfortunately, this one was spurred by a change, and it was spurred by kind of losing an opportunity to work with a really great partner in the way that we have had in the past. And so I asked Stephanie from Carroll College to join us today. And this is Stephanie back here. She is part of their faculty that has helped the health department since August of 2020 do the wastewater surveillance. And so we've talked about this program, over the years, and we are now in the 6th year of this happening in our community. We were given an opportunity back in 2020 to work with our city and City of Helena and City of East Helena wastewater facilities to collect samples. And then that sample gets delivered to a lab to get analyzed. And it's Stephanie at Carroll College that she is the lab. She is the if you think about a lab, you kind of envision lots of people and lots of equipment. And Stephanie was really doing this single-handedly. She would receive these samples from the wastewater facilities, two a week from each of them. And she would go through her process, which I may let her describe what that process looks like, but it's quite thorough and involved. And she agreed to go from doing testing for just COVID and expanded her operation to include influenza A, influenza B, RSV, and also measles most recently. So she was really just doing this out of her small lab at Carroll College, involving some really great students along the way. It was a learning opportunity at Carroll College, but it was a absolutely phenomenal support and resource that we had right here in our community. And really no other community that was doing wastewater surveillance had what we had. And then she offered to do analysis for other communities. So not only did she help Lewis and Clark out with our analysis, but you added Havre and Butte. So she's doing 3 communities out of her small lab. So it's I'm actually really disappointed that things are shifting and the state lab is going to take over those operations, because our relationship with Carol and with Stephanie has just been beyond extraordinary. She's been a really, really great partner. And the quality of work that she has done, I don't know that I can even put words around it. She has worked so hard for us. And so I wanted to make sure that we took a minute to recognize that work, have the board meet her. I've only met her in all of the years that we've worked together. I've only met her one other time. And so she really is the wizard behind the curtain. But I also wanted to give Valerie a moment, because she also has something to say and a letter to read. So I'm going to let.
Yes. Are you going to make me get teary? That's cool, but no pressure. If it doesn't happen, it's okay. And it was also a good segue, Brenda, because when you said you couldn't find words, I have a hard time too, but I tried. Okay. Stephanie. I have no idea how to start this letter, but I thought it would be kind of funny to let you know that when I first sat down to draft this, I actually spent a lot of time on thesaurus.com to gather adjectives I could use that would describe you justly. I also Googled what are the best words for someone with a high level of scientific expertise who is also just a really amazing person. It didn't have great recommendations, but I also Googled words to describe someone with such depth of knowledge they can be super creative in solving scientific questions and quandaries. My short list of descriptors that stood out to be the most included remarkable, exceptional, extraordinary, tenacity, devotion, perseverance, meticulous, discerning, just goddamn brilliant. Luminary, which was a new word for me, but I really like that word now that I know what it means. Visionary, pioneer. While I could not tell you exactly how our collaboration came to be, what I do remember is that amidst one of the most difficult times in our world's recent history back in 2020, the wastewater surveillance program was something that brought us much needed moments of hope, comfort, and laughter. Your passion and joy are just infectious, and I count myself so lucky to have been able to absorb some of that. And for some of you who don't know, wastewater surveillance was not just a completely new endeavor in our state, but also across the nation. So in a period of rapid development, the level of specificity and guidance in the guidance and methods were minimal at first and sometimes non-existent. That kind of ambiguity, requiring a great deal of creativity and discernment, would send most scientists into a frenzy, but not you, Stephanie. With each curveball thrown at you, one small example, like when your process was completely upended because of supply chain chaos, you met the challenge with what I know to be just characteristic of you. Instead of letting the bumps in the road slow you down or render you defeated, you dove in even deeper, designing ingenious workarounds on the fly and ensuring the program friendly it was to be. If it were the content of one's character, the tenacity of their spirit, their extraordinary brilliance, and their unmatched expertise that were the factors determining who manages the wastewater surveillance program moving forward. You would unquestionably, it's making me cry, it's supposed to make you cry. You would unquestionably be the luminary leading this statewide. We could have not have asked for a better partner in this effort. We cannot thank you enough for the remarkable work you've done, not to mention the unmeasurable benefits you have brought to our community. It has been such an honor and a privilege getting to learn so much from you and work alongside you. Back when you gave me a tour of your lab, I remember you telling me that it was your happy place. Sorry, guys. Oh, I sincerely hope, and I have no doubt that it will remain to be that for you, even if that means it's no longer filled with poop samples. Please don't be a stranger and know that you have a lifelong friend and ally in our public health department. I'm looking forward to the next time we get to work together. I'm not going to try to stuff this back into this envelope, but there is something else in there for you as well.
I did not realize when I selected the certificate of appreciation that it would match your shirt today.
Polka dots. Thank you so much. It's been such a privilege and a pleasure, and yeah, just one of the highlights of my career. So I appreciate it.
Yeah.
And having faith that my little lab could do this. So.
Well, I have no doubt if there's another opportunity to work in partnership with you, you're the first person we will call. There's
So
no doubt about it.
because there is a future maybe for me in ticks and mosquitoes. So. My colleague at Carroll, he's retiring, Grant Hokett, and he's been doing the West Nile mosquito collecting for 20 years. And so that's our plan starting next year. So you might, be hearing from us again. So we're just gonna drive all around Montana now and collect bugs and kill them. Line them up. A little different from wastewater. Yeah, always looking for new opportunities.
Shifting from poop samples to ticks.
I started with brains, onto poop, now on to.
Excellent. Excellent. Well, we are so lucky to have Carroll College right here in our own community, but even more with a partner in Stephanie. So thank you so much.
Thank you. Thank you all. It's a privilege.
Thank you.
Yeah.
I just want to say it's great to meet you. I was one of the ones taking the samples back when all this started, so it's nice to put a face to the sample. That was super cool stuff that you were doing. That we were just
Merchant was like, "Can you do this?" And I was like, "I don't know.
Yeah,
I'll try."
And then when they told us to collect it and send it to you, we're just like, "Sure, yeah." We just send it to them. So yeah, great to meet you, and hope to stick around. That was super cool stuff that you were able to do.
It was awesome. Yeah.
Yeah. So thank you.
Yeah, we've heard a lot about your work from Val over the past few years, and it's really an honor to be able to recognize you like this and really recognize the amount of impact that you've had in the community for the people who we're here, to represent. So thank you. So it really is an honor to recognize that work, even though we've heard it, kind of secondhand, but just seeing, what Val's able to do in her job and how that really impacts the community. It has been a learning that that's something I learned, on the board, and I don't think, we would be able to have the oversight that we have, and Val wouldn't be able to do the work here that it gets done without you. So thank you.
Thank you.
Thank you very much.
I don't know how to get out of here.
You can stay and listen to chlamydia stuff, or you could just. I can work.
Oh, that's fun.
Thanks,
You
Val.
all appreciate it.
Thanks again, Stephanie.
Bye. Have a good summer. So I have a question. Was her work the reason that they could predict another COVID outbreak, or when there was going to be an increase?
Yeah,
in
the scientists were careful to use the word predict, but it was definitely the work that was happening that let us foresee a surge.
So we could see a surge in the wastewater before it actually hit like the testing in the hospital. And so it was a predictor, but we
Yeah.
had to be careful that we couldn't say like how many cases. We could just see that there was going to be a surge. So
Isn't that weird that it showed up in the wastewater before it actually hit.
Well, and I'd imagine too, especially once home tests rolled out,
Yes.
Oh,
because then those weren't reported
Yeah.
cases. So before it, not hitting individuals that necessarily have been hospitalized yet, because that was more day 7 to 14 was when people ended up in the hospital.
Yeah.
Mhm.
That's exactly right. Yeah, it was that passive surveillance that gave us more and better information than anything else at the time. So,
How did you create that? Like, what was the impetus that made that happen?
it was some funding from the state and a question: Do you want to be a part of this? And we as a health department said absolutely. And then we started to just build relationships and figure out who could be our partner in it. And we had to build relationships with both the city of Helena and city of East Helena and help them understand what we were doing. And yeah, it was prompted by some funding that came from the federal at the federal level down.
Mhm.
And then the state helped us kind of get things up and running and the funding to do it. And yeah, but
It's amazing.
at the time, our administrator that was overseeing our disease control programs, it was his idea to reach out to Carol.
Okay.
So he said, let's just see if Carol can help us. And there was really no one else. MSU was starting to figure out a way to do it as well. Otherwise, we would have had to pay large amounts of money to these big national labs that were doing it across
And
the
it was
country.
takes so long
Yeah.
to get results.
So
That's amazing.
really lucky to have Carol as a partner.
Is she still doing it? I didn't understand.
So we had to make the transition because the state lab expanded their capacity and we are taking over all of the lab analysis that's happening in all of the sites across the state.
Gotcha.
So there's multiple sites that are doing it.
Okay. That's why she's moving on to ticks and mosquitoes.
So at the end of June, she kind of wrapped up her part of it and we transitioned over to the state lab. It's really unfortunate because the state lab is only doing COVID right now. And we had a situation where she was doing COVID, flu A, flu B, RSV, and measles. And the state lab's not intending to add any of those others until later in the year. So we're going to go months without that data. So
Interesting.
It was an unfortunate situation only because we were so happy with our partnership. So yeah. But the state lab's going to do just fine and we'll get the hiccups worked out and the data will come back again, but the transition is painful.
All right. Thank you. Thank you for arranging that. Yeah. Next update on the chlamydia outbreak from Shelley.
I know. From poop to chlamydia.
Yeah.
Welcome to public health.
That was going to help me too because she developed this really cool diagram that I think you guys will find fun. But we have in your packet, you should have had it's called the health alert that we sent out to medical providers once we identified. I'm going to kind of explain a little bit about chlamydia and then how we identified the outbreak. But this kind of explains to the provider, we send this out. We have a group email that we send out saying, hey, this is what's going on. This is what we're seeing. And to alert them to just be more vigilant in testing. But in the chlamydia is reportable. And so this is not new for our public health nurses. It's one of the trainings that we do when they become new public health nurses is we get a chlamydia case, we interview them. We gather data on maybe risk factors. Do they need other testing besides just chlamydia? Do they need HIV, syphilis? Do they need other resources? Part of our job is looking at them as a whole person and maybe they need other resources. We also try to get partners because, again, if they have sex with that same partner, they're going to get it again. That partner needs to know. Their partners need to know if they have it. So it spreads very easily. One thing nice about chlamydia is it's very treatable. Responds to antibiotics very well. So we typically will get a case and I never see it again, right? That person again, potentially. So when all of a sudden, beginning of the year, we started seeing some younger kids, not unusual, but started seeing more and more younger kids coming in, adolescents, 14 to 19 years old. When we interviewed them, typically we go back about 60 to 90 days for their partners. Those are the ones we try to treat because typically when symptoms show up, that's kind of when we look at when they would have infection. We do urine testing, so all they have to do is come in. A lot of providers do urine testing, some do swabs, but they can get tested here. We get a urine specimen, we send it to the lab, and it'll let us know. So when we started interviewing, when the nurses started interviewing, mostly Ray and Heidi and Angelique started interviewing these cases, started seeing a connection, naming the same partners. We would have that partner come in, name the same partner. We would have people anonymously showing up for walk-in to get tested because they were told that their previous partner had it. So like this case of chlamydia who came in, maybe didn't list this contact. So they would come in and say their friend told them that this person had it. And so we were starting to see this huge connection among people. Also, social networking, really Snapchat is the main connection that they're meeting each other on. Some were friends, some were boyfriend, girlfriends, some were ex-boyfriend, girlfriends, but a lot through social networking that they would just meet and connect and then move on. So the highlights of this probably are that we kind of recognized, first of all, that we were seeing increased number of these adolescents. So our chlamydia cases went up 71% since the beginning of the year compared to previous years. And then the adolescents went up 16% in that amount too. So we're really seeing a lot of adolescents, a lot more cases. So our nurses were like, we've got to do something. What can we do? What can we do? We see this connection. What can we do? So first of all, the health alert, we contacted the state and sorry, I'm going to step back one because I want you to see this thing. This is kind of, do you want to talk a little bit about this, Val? Val designed this. Sure. I gave Val a de-identified list of case 1, case 2, case 3, contact 1, 2, 3, case 1, 2, 3. And she came up with this really great diagram to kind of show where we saw the connection of the cases, the clusters.
Yeah, so what you're looking at here is essentially a network map. So I had no idea who went, yeah, like Shelley said, I had no idea. I had no information other than numbers. Case 1 was connected to this person. So I mapped all that out. There's a million different ways you can look at a network, but landed on this one. And I think there were a couple of key takeaways that I wanted to highlight through this. One was, as Shelley mentioned, very obvious close network connection. Like so there are 31 cases. They're all connected to this, basically this network of cases, and there were only 4 that had no known connection to the existing cases. So 27 out of 31 all were influenced by one another in one way or the other.
And is this strictly adolescents or is this?
Yes, yeah.
We have got cases that weren't adolescents, but we're really focusing on the connection, so the outbreak. Yeah. And they were, so the cases that are outlying are the usual ones that we usually get and we work on, but these are the ones connected.
Excellent question. I should clarify that. Yeah, this was the cohort that we were most concerned with that they were noticing these patterns in, and yeah, ranged usually between 16, 19 years old. And so each dot, as well as the little icons here, represents a case. And then I don't know how familiar you guys are with network maps, but every arrow that you see pointing to someone else means that they listed that person as someone that they had recently had a relationship with, sexual relationship with. So the one thing that I wanted to point out here that I was so fortunate that Shelley even prompted this, because I learned a couple of interesting things. One is that I learned that it's not just about the total number of connections that they had. So for example, this individual they listed 6 individual other partners, and that corresponds to the number. So this person had 3, this person had 4, etc. But when you map it out in a network like this, what you can also determine is not just the number, but what I think is almost just as important, if not more important from a public health intervention standpoint or understanding, is their, I called it influence. There's some, the network analysts call it betweenness, which is essentially a measure of influence on the network of cases as a whole. And you can kind of think of it as bridges. If you were if let's just say someone was that person that it doesn't have one specific clique of friends, for example, like they're the person that's going over here and they're really good friends with this social circle, and then they're also hanging out over here with these people. Even if they don't have 10 partners, they might be a really critical person to provide outreach to because of their influence on the network, because of their bridging, if that makes sense. Is that okay? So yeah, this is a perfect individual. Let's call this person John Doe. John doesn't have as many connections as these two other individuals, but John had an incredible amount of influence on the network because almost all of the cases you could kind of trace back through his connection to different kind of subgroups of teenagers. So the practical limitation is all these cases already happened, of course. But I think that doing network analysis like this is still really helpful, because if it did happen that this case, or even some of the others that had high influence, did come back in, let's say they wanted to get retested, we know now that that those individuals we might want to pay, special attention to in terms of giving education and outreach, or having some more in-depth conversations with them if they're willing. Which, if you're just looking at number of contacts alone, isn't really going to tell you that information. So I got super geeked out about the network analysis, and in large part just in what it can provide, another tool for us to better target and hopefully be more effective at prevention in the future. So yeah.
Yeah, so with this information, I love this. With this information, there's a couple of things with chlamydia. Is once you get treated, you should abstain for 7 days. Make sure that antibiotic has killed all that bacteria, or there's a risk of reinfection. And then, of course, we try to get the sex partners. We try to call them. It's very anonymous. We don't tell them when, what, who, where. We just say, hey, you've been listed as a contact. You need to come in and get tested. And so we really try to get these adolescents to list their contacts. And then we can also, when those partners come in, we treat them immediately. So we'll treat them immediately while they're here, while they're giving them a specimen. We don't wait for their specimen to come back if they're listed as a contact. Just ways to try to get them treated and cleared of the infection before it keeps spreading. And then, of course, we send out the health alert notice to the providers saying, hey, if you're seeing an adolescent, even if it's for a wellness, if they're sexually active, test them at this point. Like in our community, we're seeing this and we're testing it. Great examples of these adolescents. Truly very responsible. We'll call an adult to talk to them about chlamydia, and they'll be like, I don't want to talk to you. I won't call you back. They were really actually very sharing with their friends, like, hey, you guys need to go get tested. You need to go get tested. You need to go tested. Some of them were taking selfies in the waiting room and sharing it so other people would see it and come in, and we'd get walk-ins. We've been getting walk-ins of people. So they're being at least responsible and letting others know that, hey, I have this, you need to go get tested, which is actually pretty good maturity for that age, versus just saying, I'm not going to share it with you. A couple of these 4 people we did have some that didn't call us back. We did have some that didn't want to share their contacts. That happens sometimes. There's nothing we can do about that. We really try to educate, I think, like Val was saying, like educate on the reason why we want contacts. And so the other thing is we typically go back 60 to 90 days. We were seeing that some of these contacts had 16 partners in a year. We're going back and seeing, maybe getting 3 or 4 contacts in the last 90 days, but we're missing those other 7 or 10 that potentially are part of this group and being reinfected, and we may not be reaching them. So the nurses, we met and we're kind of coming up with some ideas on how we can reach these adolescents get more of their contacts, get more people tested and treated. And so what we've come up with is, number one, is we are going to, when we interview them, we're going to go back a year and try to get contacts for a year with these adolescents, hoping that we can get some of these connections that people aren't listing. And part of that was, I would interview somebody and they'd say, I had 2 partners, these are their names. But then that afternoon, somebody would come in and say, hey, I heard so-and-so has it. I was his partner. He didn't list that partner. So we know that there's some missing partners in there for some reason that they're not sharing. And so we wanted to just really try to get more and more partners. The other thing we did is some are listed as partners. Sometimes they wouldn't list a partner, but like I just said, their partner would come in. It was hard to determine reinfection. Was this person infected? Were they reinfected? Are they still infected? It's really hard when they are having so many partners. And we would have them come in multiple times. They'll come in this week and get tested. They're positive, get treated. They'll come back in 2 weeks and say, oh, by the way, I didn't abstain for 7 days. Can I get tested? Well, that's really hard because you can't retest them at 2 weeks. It's going to pick up the dead bacteria. And so to explain to them, no, we can't test you right now. It's going to stay positive. It's going to cause treatment and all this follow-up on people who may not need it. Really talking about using condoms. Try to abstain until we can come back and make sure that you're not infected again. Try to stay away from these partners that haven't been treated if you know that. So we're doing a lot of education. We hand out condoms. We hand out a lot of sexual health. And also maybe recognizing, is it consensual? Is it, trying to recognize these repeat people that are coming in. Is there something else going on in their life? And do they need more resources than just what we can provide? So we did meet with DPHHS on identifying the outbreak. And then from there, we sent the health alert to our provider saying, hey, we did a public service announcement. You probably saw stuff in the paper. Which honestly, we've had a couple of the adolescents come in and say, we're here because we heard that there's an outbreak. So even though they're adolescents, they're hearing it through their networks or through TV or whatever, that there is an outbreak. Which also a guardian brought a kid in for something and said, will you test them? Because I heard there's an outbreak and I want to test it, and they were positive. So the news, the information that's going out there is reaching these parents and these adolescents and allowing them to come in. The other thing we thought is contraception. A lot of these aren't on contraception, and that kind of just scares us to death too. So we just connected with Peer Review, and we're like, maybe we should offer a teen clinic a couple times a month. They can walk in, they can see our nurses for the urine, chlamydia, and gonorrhea testing, HIV, syphilis, whatever. And then we walk them over to a provider. We're educating them on safe sex, preventing disease, etc. And then they walk over to a provider, and they're also getting that education, but also to talk about contraception and other things that they may need from a medical provider standpoint. So we're starting that in August. It's going to be twice a month, walk-in or appointment clinic where it'll just be a warm handoff. We've collaborated with St. Pete's also, who actually was lucky. They called this isn't for adolescents, but more for the adults. They're looking at seeing if they can they can just order a chlamydia and gonorrhea test on their own without actually having to do it through a provider. And so right now it's in the works, but it's going to be for adults. And if that goes through, that would be a really great opportunity for people to get tested really quietly, easily, without having to go and have to talk to somebody if they don't want to. Options and Planned Parenthood, we've talked to them. We're really trying to encourage them when they do the testing to get partners. Can you also talk about the partners? You're their trusted healthcare provider right now. They probably trust you more than some nurse calling them from the health department. So any partners that you can get and let us know and share that with us would help us out too. So it really has boosted our relationships that we've had. And then the Montana Caring Foundation, the Caravan program, I met with them, and they're also they're going to help with maybe some incentives for these adolescents to come into these teen clinics, help cover some of the costs, because we want it to be a free or low cost for these adolescents to come in. So they're willing to help us financially take care of this teen clinic that we're going to start. And then the other thing is in the past, we haven't routinely told them to come in and get tested in 3 months. But considering how many partners they're having and they can't make it through that 7 days of abstinence, we are telling them you need to come back in, let's schedule an appointment for 3 months, let's retest your urine, let's make sure that you don't have this still, and trying to just to stop the spread of disease. So it's kind of where we're at.
Good work. Anything to schools?
School's good question. I did reach out. We have a flyer for the teen clinic, and I did reach out to the school nurses. 2 things. We were having trouble reaching the teenager themselves when we were getting cases before school was out. And so we asked the school nurses if there's any way we can connect to the student at the school. They're very limited, but they said what they could do is give the student a message. Hey, this nurse wants to talk to you. Please call her when you get a chance, which did work. This outbreak we started recognizing it right before school got out, but it did work on one person. We had one person, we couldn't get a hold of them. She gave me a message, she called us, and we were able to get her tested. So we had that going when school starts again. I did reach out to this East Helena and Helena Public Schools, and they sound like they're going to be willing to hand out flyers for the teen clinic for individuals who they think may need it or whatever. It's probably going to be, they have to go through their administration and stuff first, but so that's kind of where we're at with the schools.
No option for testing it.
We did also partner with the Friendship Center around some messaging because we were really concerned about coercion and abuse. Especially there was some talk, the nurses are hearing things because they're having conversations with these adolescents in their offices, and just coercion to have sex without condoms was concerning. And so Friendship Center they provided us a bunch of condoms as well. They're partnering with us on messaging, trying to get the word out that, it's okay to say no. It's okay to say no to sex without condoms, like really just empowering adolescents to, empower them to make some decisions for themselves. And so, yeah.
I know there has recently been a federal policy change affecting teen pregnancy grants. Do you anticipate that to affect any of the things you're trying to get off the ground?
Somebody was talking to me about that. I don't think it's going to affect us. We have made a decision right now to offer free. Our testing is really cheap. We use a ship out lab, and it's $10.50. So for us right now, we decided it was worth it. Just saying we'll do the under 26, we'll do free chlamydia gonorrhea testing. And then at this point, we've also decided to do the rapid HIV syphilis. So I think for us, it may have, yes, it's going to affect some of those other, like Planned Parenthood probably, and some of those other, unfortunately, maybe even the WIC program a little bit. But I can't remember who I was talking to about that, but they were worried about it. Fortunately, I think with us, it could affect, I can get some things reimbursed from the state, some of those 1050s reimbursed from the state if they meet certain criteria. So who knows, that funding may go down too. They're limited on how much they get too. So, but right now we've, as a program seeing this, have made a decision that we're just not going to worry about it. It's
especially about referring teens to contraception.
Yeah. And so right now Pureview has decided, I think at this point, if they're teenagers and they're coming into teen clinic, if nothing else, they'll just write it off. And we do treatment for chlamydia and gonorrhea here. It's just Doxy or azithromycin. Doxy is the first choice, and it's typically we try to charge $5 to get our money back. But again, we're just going to be like, here, take it, and take your medicine and finish it, and then come back in 3 months. So yeah.
And the reason why we don't involve insurance is because by state law, that adolescent is protected. We don't talk to parents when it comes to STIs. So that means that we can't charge their insurance.
Yeah. And it's hard because the lab we use doesn't bill insurance, and the lab is the one who usually bills for the process of so gets a little complicated too. But yeah, if they don't want to use insurance, they're considered underinsured. And so we are able to sometimes recoup some of that funds through the state STI program too. So, and Caravan's going to help with that too. So lots of exciting things going on, but it's been, I think last week we were like, okay, stop. Stop.
And then last thing, just because it affects like pregnancy care, are we seeing any spike over adolescents? In cases. Yeah, as in, should we be retesting everyone in the third trimester for chlamydia?
Oh,
Are we seeing any spike in cases over, say, age 20?
I don't think we have. Let me look. I think I have that in this one. I think we sent out. Lisa. I don't have that handy right here, but I think the state might have included that. But
Okay.
from what I've been looking at, I don't think so. But good question. Yeah.
We've been focused so heavily on the 14 to 19
Yeah.
age group that nothing else seemed to, like nothing else was that abnormal.
Not enough to
Yeah.
probably change practice. Okay.
And we have, like I said, because kids can be on their parents' insurance through up to 26, that's kind of why we picked the 26 for free testing. If they just come in, we're not even gonna talk about costs. We're just gonna be like, here you go. And then the teen clinic is really focused on this outbreak that we're seeing now, but we won't turn anybody away. If they come in at 21 at teen clinic, we're not gonna be like, nope, we're not 19. We're still gonna see them, but yeah.
Great, thank you for the update.
Yeah, thank you.
Thanks, Sean.
All right, moving on. We're running a bit behind, so I'm going to try to get us moving. We have several action items. The first, appointments for board officer positions. I did reach out to Sherry for the Water Quality Protection District representative, and I know you're interested in continuing in that role. I also reached out to Lisa about the hearings officer, and she is interested and willing to continue in that role. I am willing to continue as chair, so long as that's fine with everyone. And Mike, would you like to continue as vice chair?
Yes, I would.
Okay, thank you. So we do have everybody who's in their current sort of roles interested in maintaining those, but we'll just go through them. If anybody else is interested, feel free to mention that and we can adjust. But I think it's always good to have continuity in the department, and I think the staff appreciate that as well. So let's start with the, I guess, chair. So what's the best way to do this?
I would just ask if anybody's interested in the position of chair, and if not, then
We need a motion.
I would get the motion after you, if there's anybody that expresses.
Okay.
So just ask the question and then ask for a motion.
Yeah, okay. So yeah, let's start with chair. I'm interested in chair. Is anybody else interested in the position of chair? All right, do we have a motion to approve me as chair? And the next,
I'll move.
do you have a second?
Second.
Any public comment? No. All those in favor, aye.
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 Any opposed? All right, great.
No coups today.
Did that work? Is that good?
That's perfect.
Okay.
Yep.
All right, for vice chair, interest in vice chair. I know we have Mike. Is anybody else interested? Do we have a motion to approve Mike as vice chair?
Like that motion.
Second?
Second.
All right, all those in favor, or I'm sorry, public comment? We don't have anybody on, right? Okay, all those in favor, aye?
Aye.
Any
Aye.
opposed? No, all right. Next, let's go to hearings officer. Lisa, you're willing to be hearings officer? Do we have any other interest? All right. Can we have a motion to approve Lisa as hearings officer?
Make that motion.
Second? Second. Thank you. Any public comment? None. All those in favor, aye?
Aye.
Aye.
Any? No. All right. Lastly, representative for the Water Quality Protection District. Sherry is interested. Any other interest? Do we have a motion to approve Sherry as representative to the Water Quality Protection District Board?
I'll move.
A second? Second. Thank you. Any public comment? All those in favor? Aye.
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 Any opposed? All right. All of those motions pass. Done. Great.
That went along.
Yeah, annual review of board policies. So we have our first media policy, advocacy policy, and then the hearings officer policy. So start, which one are you?
Conflict of interest.
Oh, okay, let's.
Oh,
yeah,
there
I'm
was
sorry.
one in the packet. Is this different?
It's the same.
Conflict of interest policy, yeah.
It's the name.
Okay.
All right. Are these yours?
There are no, Mr. Chair and members of the board, there are no proposed changes to the policy. So this is just the annual review and signature.
Okay, perfect. Do we have any proposed changes to the conflict of interest policy? No? All right. Do we have a motion to approve the conflicts of interest policy?
I move.
A second? Second. Any public comment? Any discussion? All those in favor to approve the conflict of interest policy? Aye.
Aye.
Any opposed? Motion passes. The policy is approved.
And then once everyone has an opportunity to sign, you can just leave it on the corner of the table before you leave and we'll get those.
Today, 23rd, my third.
Perfect.
That's what I've been writing all morning, but I wasn't sure if it really was.
All right. Oh, next, adopting the monday.com policy. Do we want to skip over this for now until we talk about the update or the check-in?
The purpose of this action item is to look at the actual policy and then later we'll, the purpose of that item was just to check in and see how it's working, if there needs to be any like adjustments made to the use of it or the like the logistics of it. But this is the policy that was drafted to help with it's the rules of engagement essentially. So how it should be used and how it should not be used. This was recommended by the county attorney's office when I let him know we were looking for a platform for the board to use as a communication mechanism. He said, yes. However, we need to make it very clear that it cannot be used in any way to have discussion on items that need to be discussed in a public forum. So that's essentially what this policy outlines is your responsibility as a board member and how that tool can be used.
So given that, are we comfortable addressing this policy in an action item now? Is that fine with everybody? Okay. All right. Do we have a motion to approve the monday.com rules of engagement policy?
I'll move.
Do we have a second?
I'll second.
Any public comment? Discussion on the motion? Nothing? All right. All those in favor of adopting the monday.com rules of engagement policy? Aye.
Aye.
Any opposed? The motion passes. All right. Thank you. Moving on to our next action item, agenda item number 8, annual review of board policies. So we have our media policy, advocacy policy, and hearings officer policy. I guess we'll take those one by one in turn, if that's okay with everybody.
Mr. Chair, the intention here is really just to keep them in the forefront of the board's mind. So it's a moment to revisit these policies. I do not have any recommended changes. We could certainly can open those up and make edits if the board so chooses. But I didn't put them on as an action item because I wasn't bringing any changes to your attention at this time. It was really review them, remember that the policy is there, have discussion if needed about what the policy means for your actions as a board member. This is a new practice for the board. We haven't typically reviewed board policies, but now that we have a handful of them, it'll be a part of your governance meeting, which is what this ended up being, a part of your governance meeting annually to review policy. So if that's helpful.
Yeah, thank you for explaining that. I did not think to explain that because Dren and I have been talking about this sort of, kind of yearly check-in for the board to review policies, when we have to select kind of officers of the board, things like that, kind of doing all that in one meeting and trying to set that up for this meeting. But I don't know how clear I made that to everybody. Probably not at all. So that's why we have all of these kind of policies in one meeting. All right. Do we have any? Sorry, I'm just scrolling down here. So the first thing I have in my packet is the media policy. Do we have any changes to the media policy?
Yes, it's newly adopted as of February, right? We've talked about this fairly recently.
Yes, the board did review it. There were updates made. It looked like I neglected to change the approved by from Ann Weber, who was the board chair many moons ago. So I will fix that. But otherwise, yes, yes, ma'am. There were edits made, and this was freshly adopted again this past February. So this is really just a review for you. And as far as this policy is concerned, the biggest reminder here is that the board needs to speak as one, as a unit. And so if media connects with you directly and would like for you to speak on behalf of the board, what this policy says is that that needs to come back to the board so that you can speak as a unified voice. I think that's the biggest reminder when it comes to this policy.
Do we have anything in the event of, say, a pandemic that we could issue any statements as a board before a meeting? Like if we had to outside of the context, I guess the health department can issue statements, so that's fine.
Yes.
That's fine.
Yeah.
I think we also have the ability to have emergency meetings as well. I think we also have the ability to do like unanimous written consent if necessary, and so, which often takes more time with Zoom and things like that than just having an emergency meeting. But I think we have those options.
Okay, absolutely.
So any proposed changes to this? All right. Do we have a motion to approve the media policy?
There doesn't need to be any action.
Oh, there doesn't?
No, no
okay.
action.
We're just reviewing it. Okay, perfect.
Okay.
No changes. Next in my packet is the advocacy policy, which is also newer policy that we looked at recently. Do we have any proposed changes to the advocacy policy?
I would say from the review that they're doing a darn good job.
And I think the highlight here on this particular policy, especially as we gear up for the legislative session, is that the Board of Health has a voice. And the purpose of this policy when it was drafted was really to give guidelines or procedures around how you institute that voice in a situation where you want to influence policy. So the legislative session's coming up and you'll be able to exercise that ability, and hopefully this will help to do that.
Any changes? Yeah.
Just a question. For something like that, would we discuss before, say, the chair went in front of a committee?
Yes, again, and that's essentially what the policy says, is that you'll speak as a unified voice.
Sure.
And so it'll be determined at the board level what your statement is, and then what actions you would like to take. So is it a letter that's being sent off? Is it the chair standing in front of a legislative committee? You all get to decide what that looks like. And it would need to be done through a motion and action.
Sure. And would it be like informational witness more so than a?
Not as a board. You can
Okay.
you can be a proponent or an opponent as a Board of Health member.
Sure.
So what that looks like in your other capacities that you have. So Lisa, I'll just pick on Lisa because that's an easy one. She's a state employee for Department of Environmental Quality. So if she were to go before a legislative committee, she would have to make it very clear that she is there on behalf of the Board of Health. So that she is not there in her capacity as a state employee. So yeah, but the board can speak in favor or in opposition or in favor of a legislative act.
And I think normally it's not so much kind of authorizing specific activity or something. It's just setting the policy of the board so that, Drenda is aware of that, so that when she's advocating in the community, or any of us, any of us can sort of act on that, but it's sort of setting the unified decision of the board, so that it can guide the department and the other board members. Unless it's something where we have a specific intervention. We have drafted letters recently.
Yes.
Yeah.
Yeah. An example of that was some of that federal funding that was getting canceled. And so the board all agreed that, yes, we're going to submit a letter of concern to our state congressional delegation. And so you gave me that direction. I drafted it. You all approved it. I shipped it off on your behalf.
So those questions leading up to this one, does it involve the administrative board that we have as well for like the policy changes, or?
It does not. So,
Okay.
What you're referring to is the governance.
Yeah.
So that governance board only comes into play when there's a regulation. So an example of that would be our on-site wastewater regulation. When that comes up for review, the Board of Health will hear it first, and then you'll make a recommendation to the governance committee, the governance board, which is made up of only elected officials that then will essentially ratify it or adopt the regulation. And it's only regulations that it pertains to.
But what if there's a regulation at the legislative level or legislature?
That is it's not a local Board of Health regulation.
Oh, sure. Okay. No, that makes sense. Yeah, I got you.
That are owned
That makes
by the
sense.
Board of Health.
Alrighty, I see.
On-site wastewater regulation, soil displacement regulation, rabies regulation are the three that you own.
Sure.
And then you had emergency COVID regulations also that were in place that the board adopted during COVID. So those are examples of where they would come before the board first. You would go through your public process and then make the recommendation to that governing body. So
Gotcha.
it doesn't get used very often, but that's the circumstance in which it would get used.
Okay.
That governing body.
Thanks.
But this policy would allow us to advocate like for or against a state like arm, like administrative rule or something like that. So that's just to sort of like pull that into this. It kind of covers very broadly like any advocacy that's needed.
Anything happening at the federal level, at the state level, even if there's something happening within the city, the board can have a say in. If there's an ordinance that the city is looking to adopt, the board can have a voice in that. And so, submit a letter of opposition or a letter of support that the city or the county, either one, are doing.
Yeah, well, that sounds good. Yeah, I didn't know if the Board of Governance, where they came into play or did not. So no, that makes sense. Yeah, thank you.
Yeah, and I try to keep the language clean on that, but it's the governing body.
Sure.
It's the governing body and that's per legislative change that happened in 2021.
Anything else on this? All right.
The final policy was dredged up from the past. You can tell just based on the formatting of it in the packet. Fred, if you scroll the other direction back towards 26, I think.
Yeah, 25.
This one here. It was found deep in the coffers when Sandy was trying to get things cleaned up and found it. And so I thought it would be worth bringing it to you. I'm not sure that it's necessary to have this policy, but it's something that had been adopted by the Board of Health way back when. And so I thought I'd bring it and you can tell us whether you want to keep it. If so, we'll probably move it over to our current formatting. If there's any changes you want us to make to it, we can make that and then we can bring it back to you for adoption. But my question to you today is this something that you want? Is this a policy that you think is helpful? So
I would certainly defer to Lisa. I will say on the outset, like I think that everything in here is covered elsewhere.
Yeah.
but
Yeah, I think it is too. The only thing that when I read through it, I was like, well, obviously these are the things that we do. The part that stuck out to me is, well, sometimes I will hear a hearing and then sometimes it'll go before the whole board. And I like the fact that I'm not the one making that decision. It's up to staff and Drenda who know the whole circumstances and what all can play into it. So if that's spelled out somewhere else, I'm like, yeah, that's a good thing to bring out, because don't need too much rain on the mayor's office.
It is, it's clear in the on-site wastewater regulations themselves that there's an option between having it heard by the hearings officer or having it be heard by
the full board.
The procedure is not necessarily, but that's how we operate in practice. But it is, the option to do that is very clear in the regulations.
Well, and this says that the chair decides.
Yeah, which is not how we have been practicing.
And that the chair can act as the hearings officer.
Yeah, yes. Yeah, so it's really outdated language. It's not how we practice. So if you want to keep this, I would need to update it. But happy to do so if you think it would be helpful to have this policy. Otherwise, I'm going to send it back to the archives.
There's somewhere else where it's fairly well collected, right? Like where the things are collected in a reasonably single place. I mean, I know it all says it's somewhere, but
I think the regulations
are clear. Yeah.
And I think that if this doesn't match something that we're doing, like the regulations would control over a policy that we've adopted, or like the DEQ regulations too. So if there's something that mismatches, like this is moot.
Yeah.
Do we need a motion to
I think you can just give me direction. Do you want this updated and brought back before you for adoption, or do you want me to put it back into the archives?
Archives.
I say archive, and I just want it to be clear that this isn't a live policy. So whatever we need to do to make that clear for the department.
We'll make it clear on our record.
Okay.
Sandy's in charge of our official document we have a process for official documents within the department, and the reason why this came up is that she found it. And wanted to make sure that if it is a live policy, that we put it into our official documents process, and if not, we need to put archived on it and put it back.
You need to, if it's redundant, why?
Any objection to just formally rescinding this policy? No objection?
No.
All right.
I would, if you're going to formally rescind it, why don't you go ahead and do a motion?
Do we have a motion to formally rescind the current, what date is that?
2008.
Yeah, the 2008 hearings officer policy.
I'll move.
Second.
One second.
Any public comment? All those in favor? Aye.
Aye.
Any opposed? All right, motion passes.
Great. One less thing to track.
Exactly.
Thank you.
Simplify.
All right, annual review of bylaws.
So again, Mr. Chair, members of the board, this is our annual opportunity to just put the bylaws before you. Often, as a new board member, you'll get this as a part of your orientation, which is like a fire hose, right, Sherry? You get a lot of information all at once. And so best practice based on the National Association of Local Boards of Health, the best practice is to review bylaws annually, just to make sure everybody remembers what the bylaws say, and it gives you an opportunity to make sure that there doesn't need to be some kind of a revision. So I did not identify, and I don't recommend any revisions, but certainly we could do that if you have revisions that you see as a board member. But this is really just as a review, reminder, and opportunity for discussion around the bylaws.
So that training, that was at the city county building?
Yes.
I went to that.
Yeah.
What an eye opener.
Yeah.
but I left my notes in the bathroom, and Adele Johnson, that's on the water quality protection, she grabbed them for me. So I haven't seen them for a month. I wanted to review them because there was a lot, she gave a lot of examples of how we can get ourselves into trouble with our bylaws.
Yeah.
So can we table this and or not?
It is not an action item. It's really just for review. So if there are things that you want to take a look at, we just have Shannon and I put it back on an agenda again.
It's through the MSU Extension Office.
Yeah.
And I'd almost like you've had attorneys probably review these, obviously.
Yes, it's written. This was written by our county attorney's office.
Yeah,
So,
I'd almost like to run it by that gal, because she said we can run it by, if she identifies anything.
Sure.
This is
absolutely. We can, and I can do that. We have direct contact with them.
Oh, okay.
Yep.
Yes,
Local government office.
He gave some good stories, so a little scary if you don't have things done.
Yeah.
I don't know. Yeah, if we want to revisit this, I think that we can. I would just note now, I would like to propose changing all of the references to the chairman to chair to match our other policies. There are policies. But other than that, I don't have any. And if we're going to revisit that, we can do that later. I just want to mention that. Is that okay with everyone if we re-add this to the agenda later for a later meeting? Okay.
Yeah, so you'd have time in the next month to run that by MSU.
Yeah, I'll send it over to him.
And then you could bring some information maybe to us if she discovered anything.
Yep. Yeah, if there's any recommendations at all for revision, I'll note those and bring that back as an action item for the board to consider.
Okay, that'd be great.
Thank you. All right, agenda item number 10, annual review of Board of Health roles and responsibilities.
Mr. Chair, members of the board, this again is a reminder. And so I'll just take a moment to go over administrative responsibilities, policy responsibilities, and then the quasi-judicial responsibilities, which are the three categories that fall under the authority of the Board of Health. So administrative, you directly supervise me as the health officer. You'll get to exercise the annual review responsibility today at the end of our meeting. The budget is part of your administrative responsibility as well. You don't adopt it, you recommend for adoption to the Board of County Commission. That's an important role that you play. And then any kind of formal action around, especially myself. So if I requested to take like extended educational leave or something like that, that would come before the Board of Health for consideration and then a recommendation made to the county. So those are some of the administrative responsibilities that you all have. Policy responsibilities, we talked a lot about this in just a moment ago with the policy that you all have in place for advocacy. So really, you have a voice and can exercise that voice at your will for legislative action, action at the federal level, action at the local level if the city and the county are considering actions that impact public health. The work that you all do to set direction through strategic planning falls in this category as policy responsibility. Letters of recommendation, letters of support, all of those types of things kind of fall within this category. And then quasi-judicial is essentially those regulations that we were also just talking about. So adopting regulation and then all of the variance work that happens through the Board of Health is this quasi-judicial function. So it's a legal action that you are performing, which is why they call it quasi-judicial. So, any questions on board roles and responsibilities?
And this is just kind of, this is not a policy, it's just sort of an internal.
Yeah, this is the document that is used in your orientation manual. And so just, dusting that off, bringing it back to your attention. This is based on Title 50. So state law says what boards of health do And so this is really just it's a document that breaks that down into layman's terms for the purpose of training and orientation of board members. So, but it's all outlined very clearly in state law, what your responsibilities are.
The only thing I would suggest is maybe spelling out some of the more, because like there's one section that references the county commission, and then there's another section that says BOCC, which I'm assuming is
Board of County Commission.
Yeah. And so for a new board member, like it might be good to have
I can do that.
just everything spelled out. So there's no guessing. But other than that,
I can do that.
Any other discussion on that? All right. Agenda item 11, discuss results of board assessment and action plan.
So it took the board a few months to get through the assessment, and I think that's because you always have such robust discussion. And it is a long assessment. So we'll get the assessment aligned with your other governance items so that everything's happening at the same time. But it ended up being really good timing to take the results of the assessment that you all did over the course of several months and highlight, wait, don't scroll. This is it. Highlight the items that were identified for some improvement. So the assessment, if you remember, there's 6 functions of boards of health, and the assessment walks you through each of those 6 functions. And you identified as a board through that process areas that you're doing really well and areas that you could use some improvement. So I plucked out from the notes the areas where you said, oh, we should do that better, and listed those in the left-hand column as action items. So reviewing the strategic plan on a regular was one of the items. And so I'm suggesting that we continue to utilize the agenda, monthly agenda, to bring strategic plan updates to you, and then give you your annual report on the strategic plan like we have done in the past. Happy to add to that or change that if board members would like that to look different. That's what I was proposing or suggesting for that particular item. The second item is training around legal authority. I put August of 26, but you're actually going to get that today as a part of your board agenda. The legal authority is the training item today. And then number 3 is reviewing conflict of interest and statement of commitment every year. And so we had, Shannon and I had discussed January being because it's the start of the new calendar year, being the meeting in which the board does all of your governance work. It may make sense to do it in June or July because that's when new board members come on. We can play around with timing, but this review of conflict of interest can happen annually on the meeting that you do all your governance work that you like today. Implementing the Monday.com as a tool to share events and activities, that was identified as an area of improvement. And I think we've already kind of implemented that as a new way of doing business and communicating between staff and the board. And then number 5 is sharing the pay matrix is listed specifically in the assessment. And you all said that you had never even seen it. And so I put it in your packet today because we're going to be talking about my annual appraisal anyway. So I thought, well, pay matrix makes sense. We'll just throw it in there and you can see it. So that'll be done today. And then advocate for adequate facility. So in the assessment, there is a section that talks about, does the health department have what they need to do their work? Facility was named through your discussion as an area for improvement. And the role that the board can play is really to advocate that the health department does have adequate facility. So that was identified by you all, and those items were identified by you all, and I just organized them and listed them. So, and then tried to come up with a plan of addressing them throughout the year. So happy to make adjustments to this, but those are the items that essentially came out of the assessment for you.
Great. Anything else? Any discussion on that?
Do you have an update on the adequate facility? It's in the works. Wasn't there something in the works?
There is, and there's a meeting next Tuesday.
Oh,
So
okay.
it's progress, but slow progress. So we'll see what happens next Tuesday. We went, it was a commission agenda item, actually. Roger, the chief administrative officer for the county, took it before commission and asked essentially for permission to look at options, and the commission gave permission to do that. So that's a good step in the right direction. There is a facility that it's an opportunity that has been presented. And so we have an opportunity to look at that and see if it will work financially and work for the operations of the health department. So slow progress.
Okay.
But at least we're talking.
Yeah.
Yeah. For 6 or more years, there's not even been conversation about it. So we've had a lot of conversation within the department and within the Board of Health. But as far as any kind of movement at the county level, we have not. This is the first time we've actually been able to talk about something different for the health department.
And you kind of have to get out of here, right? Because they're hiring a bunch of new doctors. Did I hear that? And they kind of want to take over the space.
Well, that is part of the conversation.
Okay.
Yeah. So we coexist in this building with Pureview. It's a county-owned building, and Pureview is a leasee. So there is a need for Pureview to expand operations so that they can serve more people in the community. And then there's also the need for the health department to have space for us to do our work. So we're both kind of in need of more space, which means this building no longer works for either one of us because we're both needing more. So what the solution to that is, we're going to work through it and see what happens. So
would there be such a thing as they would move and you guys would take over the whole building?
That is on the table as part of the discussion. I think that there's some limitation to that based on the lien on the building and the grant money that paid for the $6 million renovation a few years. 10 years ago. 2016, 10 years ago, there was a $6 million federal grant that paid for a renovation, and the federal government put a lien on the building. And so
forever
for 15 years, so until 2031.
Interesting.
So, and what that says is the operations have to be provide services out of this building have to be done by an FQHC or similar organization. So federally qualified health center is what Pureview is. So they have to operate out of this building until 2031, or the county has to pay the money back.
Oh, geez.
And the county can't sell the building until 2031.
Because
or they have to
on
pay
it.
the building back.
Yeah. Okay.
So there's that. We have to work through, we have to understand that and work through that as well. Yeah. So
nothing's easy.
No, nothing is ever easy. So we have a problem to solve, and that's what we're trying to do right now, is solve the problem.
Yeah.
So we'll see what kind of options we have, and what possibilities we have, and what the commission's willing to hear. So it ultimately will go back to the commission, county commission.
Yeah.
Well, thank you for taking the assessment and turning it into this, because that was, I don't ever want to see that again, at least for the next few months. I don't have to do it next year or this year, but oh gosh, that took so long. But thank you.
We'll have to figure out a way so that it doesn't take as long.
Yeah.
So you and I can maybe think about administering it differently in this next round.
Yeah. Yeah, but thank you for kind of processing all of our, discussion and data.
I didn't even use AI. Should have, but I didn't.
All right. Moving on to agenda item number 12, Monday.com check-in.
I think Sandy prompted this agenda item. She just wanted to hear feedback. How's it going? Is there anything that
she could do differently for you? Is everybody logging in okay? Is it been a good resource for you? So
I have to log in. I haven't done it yet.
So only been 3 things, like
I-
this meeting and the chlamydia outbreak, and then another one.
the community health improvement plan presentation was put up there as well.
Okay.
There's been a couple of press releases posted. The board packet has been posted.
Okay,
Yeah,
just making sure.
full of things.
Okay, yeah, I've just periodically.
Yeah, I don't think
Go
there's
in there.
been any recent events posted except for the community health improvement planning
Okay,
presentation, which happened at the end of June. So I don't think there's been anything posted since then for events.
It's working fine for me. I'm not having any problems at all.
Well, I'll be honest, I haven't done it, but I'm 99% sure I'm gonna have to do my personal.
Okay.
And not my
Your
government.
state.
Mhm.
Yeah,
I'll get,
I have to as well. I have to use my Gmail account
yeah. that's
to
what
log
I'll
into
have
it
to-
rather than my county account. So
I'll get Sandy to have her send that invitation to
Yep.
that email.
and if you have any technical issues at all, Sandy's great. She can help you work through anything. But what we'll do is probably leave this on the next few agendas and just keep asking if there's anything we can do differently to make it a usable and valuable resource for you all. So I think it's fairly easy for her to throw things in there. It's not a burden at all. So she'll continue to do what she's doing, and then we'll wait to get feedback from you on making adjustments.
I think I don't have access to one of the like pages or something that she demonstrated, so I might reach out to her like about that. But I think otherwise, yeah, for me it's been easy to set up.
Okay. Yeah, and just remember that the whole board manual has been loaded in there now. So if you're looking for regulations, for example, it's really easy now to go in and kind of navigate to where the regulations are posted instead of scrolling through the manual that's on the website, 800 pages or whatever that thing is. It's just a PDF that goes on forever. She's broke it all out in monday.com as a usable resource that lets you like click to the thing that you're looking for.
Well,
So if you just remember that it has all of those resources in there for you too.
is it through a search engine? Like you can search, you can type in a word and it'll take you.
See. It's kind of just tabbed. So under Board of Health Resources and Training, it just lists like all the things that you would need that come out of your board, like the variance procedures, regulation process.
I think there is a way to search. Yeah. So if you
Oh,
have,
there
like,
is. There's a search button right there.
Okay,
Yeah.
awesome.
And so,
then
yeah, I
it'll
searched like
find-
regulations, and it seems like it's searching both like the title of documents as well as any notes about the document.
The new strategic plan's loaded in there, so if you want to remind yourself what's in the strategic plan, it's loaded in there for you. Yeah. So you have all the resources at your fingertips, so you don't have to work so hard
That's
to
good
get to
because
them.
I've got piles of paper
Yeah,
for all
yeah.
these meetings.
And the board manual up to this point, like I said, is an 800-page PDF that's posted online and really not very user-friendly. So this is much more user-friendly for you to find things.
Nice.
It's been a year, I think, because like I think I've kind of mentioned that for the first time last year this time. So I'm happy to see some progress, and like hopefully the whole purpose is that hopefully it's easier to navigate and kind of more for me, emails can very easily fall through the cracks. And so I wanted to come up with something, and yeah, Sandy has been really really great to put in a lot of work to find this resource, to kind of identify that this was based on kind of what I said, the most usable tool available and has put a lot of work in setting it up.
Yeah, she had to build it out.
Yeah.
So, yeah.
Wow.
So in a year,
Yeah.
we're here.
Yeah.
Yeah.
So I really appreciate that.
Yeah.
I'm excited to.
Yeah, she did a really good job. The news section was the most recent, like, tab added or section added news items. And so anytime we put out a press release or a news release to, we load them there for you. Because in the past I had been emailing them out so that you would see that before you saw it on the news. I wanted you to be able to see that we put something out to the media. Didn't want you to get caught off guard as a board member. So now those are all being loaded in to anytime we put out a news release or a press release, media release, whatever they're called. They're in there for you. Mhm.
You've not been tagging us. You just have been loading them up or loading them in.
Correct. You have to set up your notifications. So you get to decide whether you get a notification every time she puts something in there, or if you don't want to get a notification. So you make it that decision and set your notifications up accordingly.
All right. Any additional feedback? Okay. Thank you.
Yeah, we are right on time. So nice job.
All right. Moving on. Agenda item 13, training on legal authority of the board.
So this is a video. It's not painful, I promise. But I'll have Fred, if you want to stop share, I will then share. Just, okay, perfect. Mike, you can see that?
Yes, I can.
All right, perfect.
I'm going to shift gears a little bit and review both the local Board of Health and Health Officers Authority based on Montana Code Annotated, which is Montana's state law. Much of the Public Health Authority in the MCA is located in Title 50, which I'll review briefly here. However, other areas of the MCA include other specific authorities for public health on a number of.
Oh. Sorry. I don't know what I just did.
Key issues such as food safety.
So because I skipped to like the end of this training module, what you missed was the introduction of who the trainer is. It's Todd Harwell. I don't know if you all remember him, but he used to be the Public Health and Safety Division Administrator at Public Health and Human Services for many years. And so after he retired, he decided to team up with Confluence Public Health Alliance and the University of Montana Public Health Training Center to put out materials like this. So Shannon met him at the Board of Health sessions at the Confluence annual. A couple of the sessions, or actually he facilitated the whole thing.
I think, yeah, for the health Board of Health members.
Yeah. So this is who this is. So he comes with lots of credentials.
First, I'll start with what is the policy of the state of Montana and the purpose of the public health system based on Montana state law. It's the policy of the state of Montana that the health of the public be protected and promoted to the extent practicable through the public health system while respecting individual rights to dignity, privacy, and non-discrimination. And this is the high-level policy statement for public health based on Montana state law.
That is language right out of Title 50, right out of the law.
Purpose of the Montana public health systems to provide leadership and protect and promote public health by promoting conditions in which people can be healthy, provide or promote the provision of public health services and functions, including the the ones listed here. Monitoring the health status to identify solutions to health problems, and this is an example would be community health assessments, investigating and diagnosing health problems and health hazards, informing and educating the public about health issues, coordinating public and private sector collaboration and action to solve health problems in the local jurisdictions, developing policies, plans, and programs to support community health efforts, and implementing and enforcing laws and regulations that protect health and safety. In order to carry out the purpose of the public health system in collaboration with both federal, state, and local partners, each Board of Health shall identify, assess, prevent, and ameliorate conditions of public health importance through epidemiologic tracking and investigation, screening and testing, isolation and quarantine measures, and then these other measures you've seen here. In addition to those duties, local boards of health also have duties to prevent the spread of communicable disease and other conditions of public health importance, including through actions to ensure the removal of filth and other contaminants that might cause disease or adversely affect the public's health. They also have the authority to supervise and make inspections for conditions of public health importance and issue orders for compliance, correction, destruction, or removal of those conditions. And then boards of health also can pursue and bring actions and issue orders necessary to abate, restrain, or prosecute the violation of public health laws, rules, and regulations. These Board of Health duties are often delegated to both the health officer, the health department director, and the staff at the local and tribal health departments, including the sanitarian. And these delegation of duties are often in the Board of Health bylaws. It's important to have this delegation duties clearly outlined in your bylaws. And regarding the last bullet shown here on issuing orders and pursuing legal action, generally these are rare occurrences when these happen. And it's primarily because Montanans and Montana businesses understand the importance of these issues at hand and comply with the local jurisdiction's orders. Now I'm going to review the duties of the health officer. In order to carry out the purpose of the public health system in collaboration with our federal, state, and local partners, each health officer shall make inspections for conditions of public health importance and issue orders for compliance, take steps to limit contact between people in order to protect the public from imminent threats, and this could include building closures or cancellation of events. An example might be a school outbreak from diphtheria or pertussis, where the local health officer determines that it's best to cancel basketball games to prevent the spread of that disease. Other health officer duties include reporting communicable diseases to the Department of Public Health and Human Services as per the DPHHS's administrative rule, establishing and maintaining isolation and quarantine measures as adopted by the Board of Health, and pursuing legal action for violations and compliance. In addition to the health officer duties I just reviewed, health officers can also request assistance from law enforcement officials if needed for implementation and enforcement of public health issues, examination and treatment for tuberculosis. They also have powers and duties related to the treatment and control of sexually transmitted infections.
That's the law that allows us to do our work. That Shelley just described. And it's also the law that says that the adolescents are protected and their confidentiality is protected. And so that's the law that dictates what we can or cannot say to a parent, for example, that one.
In 2021, the legislature made some changes to the authority and duties of local boards of health and health officers, and I'm just going to briefly walk through those. The first was a change where the local boards of health could make recommendations to their governing body, which would be the county commissioners, regarding the appointment of the health officer. Previous to this session, the local boards of health would hire the health officer and identify that person. A second change that happened during that session was where boards of health and health officers, if they issued orders during a governor-issued emergency or disaster, there were new provisions in terms of the governing body or county commissioners being able to revoke those orders. And finally, during that session, there were specific limitations to boards of health and health officer orders, excluding all lawfully adopted regulations, directives, and orders. Each of these changes from that legislative session for the MCA code are listed here, and you can go to those for more information.
After that change happened in 2021, the bylaws were updated with that language, and then there was an updated interlocal agreement that was we already had an interlocal agreement in place, but it was revised and re-signed by County Commission, City Commission in East Helena. So all of those changes are now reflected and have been reflected in those documents since that time. So. Any questions? So that was the end of that section around legal authority. Any questions or discussion you wanted to have?
It's good to have a reminder. I think I've read some of those sections like 2 or 3 times, enough to know like there's something somewhere that talks about a topic. Then it's nice to have a refresher.
Yeah. Well, I think it's interesting because from my perspective, my normal day job is to protect public health through public water supplies. And so we at Public Water Supply Bureau will issue health advisories or boil water advisories or do not consume advisories. And lots of times local sanitarians think that I'm the one who has that power, but I'm not. It's actually them because the power has been delegated to them through the health officer. And so while Lewis and Clark County has a good handle on, like the bigger counties have a really good handle on what their authority is, the small counties need some help. And so this helps me help the smaller counties understand their roles too. I just tell somebody the water's not safe to drink based on X, Y, and Z. I can't make them not drink it. I can't close licensed establishments. That's the local sanitarian or health officer who's responsible for that. So I think just to help maybe put into perspective what the rules and regulations are, it really does, that authority really does lie with the health officer in those individual counties.
Interesting. And another example that it's a delegated authority from the Board of Health to the health officer. But another really good example is if we identify somebody that has a communicable disease and works in food service, we have the authority to remove them from that high-risk environment in order to protect the public from exposure. And that is outlined very specifically in law that action can happen. It is these laws that we saw during COVID butt up to people's freedoms. So, but it is these laws that protect our entire community, right? And so that is the debate that was happening at the time of COVID. And all the way, I was just reading an article about the Spanish influenza and realizing that what they went through in 1918 is the very same thing that we experienced. It's like humans don't learn. We had the very same debates in 2020 and 2021 as they had in 1918 and 1919 around public health authority and how it really does kind of come up to individual freedoms. So it makes this work really hard, but it also is so important that these laws exist to protect everyone in the community.
So that really came up. Is it Shelley?
Yes.
Yeah, the nurse. When she was talking about that one character in the middle that had like 16 partners.
Yeah.
And there's nothing you can really do about that, right? Is that true? Like when he's wreaking havoc.
Yeah.
I mean, that's putting it lightly.
Yes.
But is there anything, is there a point where something can be done?
Well, what we are doing right now is a lot of education and outreach, but as far as like removing that individual from society, we would have to take that to the courts. Could do it. And there is case law that has shown individuals positive with HIV that were purposely infecting others at the time that it was essentially a death sentence. Now it is not. I mean, it's considered a chronic disease. There's medications. But at the time that it was not, we didn't have the medications and the pharmaceutical interventions. It was essentially a death sentence. And so there is case law that shows that individuals that purposely infect others can be held legally liable. And so we would pursue those if needed. So yeah, we would have to take all of that to the courts and ask that tuberculosis is another one, it was listed kind of as a separate law. And that's because tuberculosis is, we have to do, in order to remove that individual from society, if they are treatment resistant, or we have the ability to take that individual and remove them from any situation where they can infect others. But we have to go through a legal process to do it.
Yeah.
Mm-hmm.
And it makes natural news when that sort of thing happens.
Yeah.
Yeah.
It's a couple times in the last decade.
Yeah.
It's not like necessarily in Lewis and Clark County, but like nationally, like those sort of authorities are generally used. My understanding is for communicable diseases, not necessarily something that would kind of require a consensual contact that right, but like where somebody's being socially, close to other people unwittingly could be passing a disease. Yeah.
Wasn't that originally why they established the facility at Galen?
For tuberculosis.
Yeah, I think so.
Or communicable disease isolation.
Yeah, I think.
I'd have to find that history.
Yeah.
You know who would know that is Todd Harwell. He is our public health history buff. And I bet you he would have the story of what Galen was used for originally.
Yeah, I think it was a TB hospital.
TB hospital. All right.
Kellogg, Idaho had one.
Yeah.
TB.
The history of Typhoid Mary is quite interesting as well, because she was imprisoned because she refused to comply with public health standards at the time. They were just learning.
Twice.
She didn't learn the first time.
Yeah. And was cooking like food for people. That's any additional discussion on that? All right. Okay. Do we have any announcements?
No
Didn't
announcement.
look like
I don't have any announcement.
Right. Agenda item 15. Anything under the purview of the board that's not listed on the agenda? Do we have any public comment? No. All right. We'll move into our closed session.
And I'm reminded that County Attorney Aniko Hash in the past has reminded me to remind the board that in order to go into closed session, you actually have to identify why and motion to do it. Okay, so that's
Great. Do we have a motion to convene a closed session in order to conduct the annual performance appraisal of the health officer? A second. Thank you. Any public comment? All those in favor, aye.
Aye.
Any opposed? The motion passes.
So Mike's on here, so if screensaver or something comes on, just text me.
So what we'll do, it shouldn't hit Teams usually, but what we'll do is we'll shut the.
Can it be deadly?
Oh.
And
Yes,
close
it's very rare. It can, I mean, I've seen.
So this is
He's a panelist.
It's lesser can cause like a wider inflammatory disease if it gets out of the lower uterus up into the lower abdomen.